So let's move on with the next talk, and afterwards we'll have a question and discussion session. So next talk is given by Rolf Apweiler, and he will speak about the European COVID-19 Research Data Platform.
Okay, hello everyone. I hope you can hear me. My internet connection was earlier today a bit flaky, so that's good. And let's see whether I can also share the screen. That works. And yeah, can you see it? All good? Okay, good. So yeah, so this will be something completely different. So, but hopefully at some stage quite useful for you. Wait, I need to get, oh yeah, there it is. So the aims of this European COVID-19 data platform we developed together with our Elixir and EOSC Live colleagues at EBI is to collect European data from diverse sources and of different types to make sure that available research data gets exchanged quickly and shared quickly. We allow for different, sorry, that was the wrong way. We allow for data sets with different degrees of aggregation, validation, and completeness to enter the system. And we hope that this enables synergies and cross-fertilization across research community. That's, of course, all a bit lofty, and I try to explain it a little bit better. So there are people who do research in the area of COVID-19, that's doing things. And there are people who try to enable research on the service end. That are people like me. And you can see that that we expect various streams of data coming in. One is the SARS-CoV-2 virus biology data. Essentially, it means sequences, RNA sequences. And there is the human COVID-19 biology. That is the host data. There will be, as far as I can see it, a lot of patients will not only get their virus sequenced, but also they get genotyped or exome sequenced or even whole genome sequenced. Because there is the interesting observation that has been already made a while ago that not only old, frail people with underlying health conditions are becoming victim of COVID-19, but also a lot of apparently young and healthy, relatively young and healthy people, where it's unclear why they are vulnerable. And the clue may be in some of the genetic makeup, which through GWAS studies probably could be found out. And that's, of course, pretty important, because if we want to go back to a normal life, we need to find ways to identify the people who are especially vulnerable towards when they get a virus infection, and they need more protection than people who are having no or very mild symptoms. And so, and then there's a whole raft of data generated on the population dynamics of human and the virus. So on the SARS-CoV-2 virus biology, we have set up, and I will talk a little bit more about that later on at EBI, so-called data hubs to deal with that. And the human COVID biology is in the European context, and I think even the global context will be dealt with a federation of the European Genome Phenome Archive, which can is able to hold this controlled access data in its databases. So that's where we have structures in place. There's also a lot of other research going on, which has already structured homes, mainly at EBI and but also at partner databases. And that is in these boxes like protein-protein interactions, phylogeny, and so on mentioned. But the work on population dynamics of human and virus, all of that is really handled by national public health institutes and national infrastructure. It's handled in the research setting, in a clinical setting, and that will not have one central home or not one center of gravitation for such data, but it will be widely distributed and quite dispersed. So, as I mentioned, the virus sequence data will allow us the understanding of the biology, epidemiology, and transmission and evolution of the virus. And for that, we have this COVID-19 Data Hub set up. The human host sequence and phenotype data allows understanding of the host pathogen interactions, will be dealt with the Federated EGA. And the multitude of other research activities where the European Life Science Bioinformatics Research Infrastructure, ELLIS, is monitoring and cataloging and keeping an overview of the national level activities and data sets to make these relevant sources available for linking into the portal. So that is a rough schematic scheme of that. Patients are entering the national health systems. There are national health data infrastructure, and public health laboratories, which deal with patient information, with virus sequencing, and so on. Some of this can then go into the SARS-CoV-2 Data Hubs at EBI. This, together with data from other sources which have a structured or not so structured home, these other data sources can then be collected and go into the COVID-19 data portal, and from there this can go to the users. All of that is not done by us in isolation, but in the framework of other European research infrastructures and of the European Open Science Cloud, and there especially EOSC Live. So with SARS-CoV-2 Data Hubs, they do the sequence data management. So their primary users are really public health agencies and sequencing centers. So we have been in contact so far with 15 different countries in Europe who are interested to use this mechanism to bring their sequences into the public. We have right now the first 2 countries that are putting these data into the private section of their data hub. And hopefully they will be then pushed out very soon into the public. The data we are storing there is really raw data, BAM files, and also then later on the assembled consensus sequences. So all of that will be available later on to the public. So we're expecting already from the ones who told us that we would submit the data, we expect that these 5 countries should contribute something like, at the beginning, something like 1,000 coronavirus sequences a day. And depending on how much they want to ramp it up, it will be, of course, quite a bit more. So that will be a significant amount of data. So yeah, that's about this. Host data, human data, where we need to look into an acceleration of the Federation of the European Genome Phenome Archive. The European Genome Phenome Archive holds already more than 1 million human genomes. It's in a collaboration right now between EBI and the CRG in Spain, and it's Europe's home for controlled access human genome and phenome data. We had already planned to federate that. Federate means a sort of clone of the EBI CRG instances would be existing in more or less every European country, so that it can get populated with the national data, and therefore would have no troubles with conforming to national legislation, ethical and regulatory restrictions. It would display then the metadata it can display to the whole system, so that people can find the appropriate data sets wherever they are, whether they are in Germany, in Luxembourg, in Spain, in Italy, in Finland, in the UK. So That's now, we've had a plan to roll that out essentially over the next 3 to 5 years. I think we're talking here now about 3 months to a year to roll that out in a workable manner. And this is great because it aligns also then with the plans to enable access to national genomic, clinical and phenotypic data collections as part of wider initiatives. And so we'll be just accelerating these developments. It will be not a sort of quick solution just to one problem, but it will be also instrumental later on in the strive towards personalized medicine and genomic medicine in a European-wide setting. Yeah, the COVID-19 data portal would be for the users, the primary entry points. We upload data there, people can find the data there, can download it, they have access to reference data and special tools. We had already for foodborne disease outbreaks pathogen portals and data hubs existing, so we just repurposed some of the code to deal with that. So that was why we could deal with it relatively quickly. So the status of this platform, which consists of these components, hubs and data portal, the data hubs are functional. Data is flowing, and has not made it into the public, but I hope that every day the first country will push the button that it's not only in their controlled space, but out in the public. And then it gets really interesting for people to download it and work on it, not having just hundreds of sequences, but very soon tens to hundreds of thousands of sequences. The COVID-19 data portal was launched on Monday, I have to say. At the moment, it's rather limited. It displays data already in the most important ELLIS databases and links to wider Elixir COVID-19 catalog and other resources. I personally would have loved not to release it yet, not to launch it yet, but to wait another 4 weeks before we have to show more and better. So I think, but there was a lot of political pressure to release it very early. Not from EMBL, not from EBI, but more from the Commission side, and we understood their concerns and did that. But there's a lot to do. We need to handle all COVID-19 related data sets already in all of the EMBL EBI databases. Not even that we display in the portal right now. There needs to be a lot of user experience-based design improvements. At the moment, the portal is full of jargon abbreviations, which shouldn't be there. They should be understandable for people directly what they are looking at. And I'm not very happy with that, but I say that's straight away here. So we need to do a lot of improvements there. We need to link to other relevant European projects and research infrastructures, need to link tools or links to tools, and incorporate relevant data sets from other projects. So since this is constant deployment, we can do all the continuous deployment. We can do quick changes as they come in. So that's good. So I think in 2 to 4 weeks, this will be a really valuable thing. At the moment, I think it's valuable. But as I mentioned before, I would have waited another 2 to 4 weeks with a lot of internal testing and improvements before we made it public. But here we go, it's there, and now we need to do the improvements on the live portal. And with that, I don't want to waste any more of your time, and I'm ready for any questions and say thank you.